Hello and welcome to Delivering Miracles, a podcast to give moms like you strategies and tips to have a safer pregnancy so you can bring home a healthy baby. I'm your host and your high-risk pregnancy expert, Parijat Deshpande. The other night, I was scrolling through my Twitter feed, just kind of catching up at the end of the day, checking out what was going on, what people are talking about. And because of what I do, I follow a lot of fertility and pregnancy Twitter accounts, doctors and organizations, companies, groups, magazines, online experts in the realm of fertility and pregnancy, obviously. And I remember I was scrolling through it and I saw this article that said, don't eat too much cheese during your pregnancy. And right below that was a post that said the importance of eating cheese or dairy during pregnancy. And I just sat there and I'm like, really, right above and below each other or two completely contradictory articles. And so I kept scrolling and I just noticed how many times that was happening. Do this, don't do this. This is really good for your baby. This is really bad for your baby. Just non-stop contradictions about what you're supposed to do, how you're supposed to eat and sleep and behave. And oh my God, I'm not even pregnant and I was overwhelmed. I can only imagine, especially if you're pregnant for the first time, how confusing that is. Where do you turn to for information? And the research is constantly changing. And so what doctors recommended a year ago, they're sometimes turning around saying, oh, actually, that's fine now. It's not a big deal anymore. And that's really confusing. And that in itself can cause a lot of stress during your pregnancy, because what are you supposed to do? Who are you supposed to listen to? Especially when you start comparing notes with friends who are pregnant and their doctor's telling them to do one thing, your doctor's telling you to do something completely opposite. You know that everybody's pregnancy is different, but come on, can we have some standard information, right? It's confusing. It's super overwhelming. And then you add on to that everything that your family's telling you, right? The folklore and the traditions that are passed down from generation to generation that people want you to abide by. Don't sweep the floor, or don't announce too soon, or don't drink cold water. And this is just something that is told from generation to generation in your family. In my culture, there's a belief that you don't schedule the baby shower in the 8th month, which is about 32-ish to 36-ish weeks, because back in the day, when a baby was born that early, it didn't survive because they didn't have access to medical care that would help a baby born that early to live. And so there's this belief that gets passed down from mom to daughter or to daughter-in-law that you jinx the baby if you celebrated that pregnancy at that time when, if the baby's born, it may not survive. Now, this has become a laughing matter in our family now, because if you followed my story, my son was born 2 months before the 8th month mark. And even with access to excellent medical care, he almost didn't survive. And so needless to say, we do not believe in this in our family anymore. But it goes to show you that between all the experts online and your doctor and then your family members, there's so much information being thrown at you about what you're supposed to do and what you're not supposed to do. And what if you hurt the baby? And what if you do something wrong? It's just, oh my God, it's too much. So I thought it would be fun today to play a little game that I'm calling Fertility and Pregnancy Fact or Fiction. I just thought it'd be great to lay out some of the basics of what's real, what you really should be listening to during your pregnancy or when you're trying to get pregnant, and what's just kind of general advice that might sound like fact, but really is nothing more than fiction. So I thought that might be fun to do today. Because the thing is, it's really important that you know the difference between fertility and pregnancy fact and fiction, because that's how you can make healthy choices for you and your baby. You don't want to make decisions or choices because you feel obligated to follow somebody's advice or because you're confused. You want to make them from a place of being informed. So that's what today is all about. So play along and see if you know your fertility and pregnancy fact from fertility and pregnancy fiction. I feel like we should have some kind of game show music here or something. A little Price is Right or Jeopardy or something. Here we go. Game starting. All right, here we go. Number 1. Eating spicy food helps you go into labor. You know, my mom tried this. When she was pregnant with me, I think she delivered me about 2 days before her due date. But she is a petite woman. She's tiny. She's like 4'10". And I was a big baby for her. I was just shy of 7.5 pounds, which is huge. And so she was so over her pregnancy. It was summertime and she was just done. So a few days before I was born, she went to this pizza place by their house. And just like they did throughout her entire pregnancy, people commented on how huge she was and saying things like, "Oh my God, you must be due any second now. Are you in labor right now?" And I mean, throughout her whole pregnancy, people would come up to her and be like, "You must be carrying twins. There's no way. There's just one baby in there." She's like, "Yeah, no, there's just one. Believe me." And so again, all these comments coming at her. And so they ordered the pizza, and her thought was she was just going to eat a bunch of spicy pizza and see if that started labor because she was so done with it. And it's so interesting because she didn't even order the jalapenos at the counter. She went to go sit down, and the guy who took her order brought her a giant jar of jalapenos to eat with her pizza. So not only did she believe that eating spicy food could just end her misery and kind of bring this baby out into the world, but he believed it too. It's just this kind of general communal belief that eating spicy will kickstart labor. But this is actually fiction. Labor starts with changes to the hormones that are created from the placenta, and it's not affected by what you eat. There isn't actually a direct connection between your stomach and your uterus. So there's no reason to believe at this point that what you eat is going to kick off labor. So if you like spicy food, eat it because you like it, but it's not really going to start labor if that's what you're going for. What helps kickstart labor instead is if you are at term or post-term and you really want to help your body along, you can try having intercourse, you can go for a walk, or you can try nipple stimulation. All 3 of those things have been shown to work. But I'm going to say here, I'm going to be really clear about this, do not do this until you've reached your due date and only after you have talked to your doctor about it. Do not try any home induction techniques until you've talk to your physician, because inducing labor at home can be dangerous, especially if you have a high-risk pregnancy. So don't try this at home until your doctor's signed off on it. But if you're ready to have that conversation, you can ask them about intercourse, going for a walk, or nipple stimulation. All right, number 2, lifting your legs up in the air for 20 minutes after intercourse will help you get pregnant. This is also fiction. Sperm are made to be able to travel upward towards your egg no matter what position you're in. You've seen the pictures of sperm, right? There's a head and then there's a little tail. And that tail is exactly what this is for, to help the sperm literally swim. So even if you stand up right after intercourse, you still can get pregnant. Now, I know what you're thinking. What about gravity? What about the fact that it could all fall out? So let's talk numbers for a second. Every time your partner ejaculates, he lets out somewhere between 40 to 240 million sperm. So even if you stand up and a little comes out, there are still plenty of swimmers that are trying to reach your egg. And remember, you only need one to make it there. So if you're trying to get pregnant and you want to increase your chances of conceiving, instead of worrying about the position you're in after you have intercourse, focus more on a healthy diet for both of you. That's actually more important than your position. And this is for both of you. This is not just for the woman. A high diet in leafy greens like kale or spinach, or eating a ton of legumes like beans or lentils are great for you to regulate your cycle, help you ovulate regularly, and improve your egg quality. But they're also good for your partner because it helps maintain a healthy testosterone level and it improves his sperm quality. So if you've been trying for some time, you're wondering why it's not working, try changing up your diet and seeing if that works. Now, if it's been some time and you're worried that you're not getting pregnant, I highly recommend that you also see a fertility specialist. Now, the guidelines are to try on your own for a year if you're under 35 or 6 months if you're over 35. But I like to be on the conservative side, especially if you know that you have an underlying health issue or your cycles are a little wonky or there's something going on. If you've been charting your cycles regularly, you've been trying consistently, and you notice that something isn't quite right, even if it's been 6 or 8 months, I think it's a really good idea to go see a specialist, do the preliminary testing, and see what's going on so you don't waste any more time. Okay, number 3. Don't change cat litter when you're pregnant. This one's a fact. Ideally, if you can, get someone else to do it because cat feces carry a parasite that causes an infection called toxoplasmosis. Now, it doesn't happen very often. It's actually quite rare. But when it does happen, it can be devastating and can cause serious problems to your baby when you're pregnant. So don't chance it and just get somebody else to help you change the cat litter. You can, however, pet your cat as much as you want. That doesn't seem to matter. Okay, so far we have done number 1, eating spicy food does not help you go into labor. Lifting your legs up in the air for 20 minutes after intercourse to help you get pregnant is also fiction. And don't change cat litter when you're pregnant. That is a fact. So number 4, don't eat sushi when you're pregnant. I'm calling this a fact-ish. So here's where I'm coming with that. There's a huge push in the United States. Lot of doctors, lot of experts saying, don't eat sushi, meaning raw fish, when you're pregnant. The reason for that is you could get sick and you don't want to have access to or to eat and consume high levels of mercury. You don't want to get sick. You don't want to expose your fetus to anything that comes from raw fish. But the question that arises is, what do Japanese women do in Japan? Well, if you look at their diet when they're pregnant, they eat sushi. They eat raw fish. So what's the deal? Why is it different here versus there? So some doctors here in the United States say that as long as it's high quality fish and you don't eat it all the time, you don't want to eat sushi or this raw fish every single day, even if you would love to, as long as you don't eat it all the time, it's okay. Go for it. A lot of doctors in the United States do say that. But there's still this push. You still hear just as emphatically, don't eat raw sushi. Now, I'll be honest. I love sushi. I really could eat it every single day and never get tired of it. I love sushi so much. But I didn't eat it when I was pregnant. And at first I was like, oh my God, I can't believe I have to give up sushi for 9 months. And then I wasn't even pregnant for 9 months, so I got to eat it sooner than I expected. But I didn't, because I didn't want to risk it just in case I couldn't find high quality enough sushi. And it seemed like a small enough sacrifice for potentially 9 months to give up sushi. Although I did tell my husband that once, before we knew he was going to be born early, I told him once he's born, I want sushi that night. And he'd agreed and it was fine. But I did have friends who did eat sushi and raw fish during their pregnancy. They talked to their doctors, they got the okay, and their doctor said as long as it was high quality, go for it. It's fine. So here's the deal. If you love sushi, but you don't want to risk it, and it's going to cause you too much anxiety to eat sushi and then to wonder if you made a mistake or not, don't do it. It's not worth it. You can get the same nutrients in a different way by adding fish that's low in mercury in your diet on a regular basis, and just try out new recipes, new fish recipes. The omega-3 is so good for you. It's so good for your baby. The only fish that you want to avoid during pregnancy are mackerel, tilefish, shark, and swordfish, and you want to eat tuna in moderation. But if you're dying for sushi and you're just like, oh my God, I just cannot wait until the due date. I need my sushi right now. Go talk to your doctor and see if they'd be okay with you eating high quality sushi, and ask them to show you the research on why they're recommending what they're recommending. If they're saying yes, talk to them about why. How is it safe, and why is that not being talked about more often? And if they're saying no, ask them about high quality sushi and say, there is research out there that says it can be safe. Why are you saying the opposite of that? And just to get an understanding, you don't want to be combative about it, but just understand where they're coming from so you can make the informed decision about what feels good to you during your pregnancy. Okay, number 5. This one is interesting. You're most likely to get pregnant on a full moon. When I was in the hospital with my son, I was on hospital bed rest for 15 days. If you listen to, I think, episode 1, I talked a little bit about that experience. So when I was there, and then when I was in the NICU, because obviously my son was there for months, I would hear all the time from the L&D nurses and the NICU nurses saying, oh no, it's a full moon. We should expect lots of babies. It's going to be really busy around here. All the time. Every time there's a full moon, they would say that. Now that, based on research, has been proven false, because there really is no connection, it seems, between the full moon and delivery. But because there's so many cultural ties to the belief about the moon and the cycles and how they're connected in terms of labor and delivery, it's just this folklore that's really stuck around for a long time. So people, even nurses, talk about it. But it begs the question of, does that affect how you conceive? Now, I'll be honest, I had never heard of this one until just recently. And it seemed a little iffy to me. Like, how can that be true? I don't even understand how it's possible to be true. It's not something that I know a lot about, and it's not something that I believe in really. But so I started doing a little bit of digging, and I found this excerpt that I want to read to you. It's by Dr. Christiane Northrup, who is a world-renowned obstetrician. And she writes, studies have shown that peak rates of conception and probably ovulation appear to occur at the full moon or the day before. Environmental cues such as light, the moon, and the tides play a documented role in regulating women's menstrual cycles and fertility. In one study of nearly 2,000 women with irregular menstrual cycles, more than half of the subjects achieved regular menstrual cycles of 29 days length by sleeping with a light on or near their beds during the 3 days around ovulation. So that's actually really interesting to me. I think it really sheds light. No pun intended. I'm sorry, that was totally not planned. No pun intended. But it really does shed light on, how else can we regulate our cycles besides taking medication and hormones, and even without ingesting anything, even without vitamins and supplements. Are there ways that we can regulate our cycles, especially for women who have irregular cycles? So all that to say, this one appears to be a fact. Although I'll be honest and say I'd like to see more research on this to really understand what the impact and the connection is. Okay, so we have gone through 5 so far. Eating spicy foods helps you go into labor. That is fiction. Lifting your legs up in the air for 20 minutes after intercourse to help you conceive is also fiction. Do not change your cat litter when you're pregnant. That's a fact. Don't eat sushi when you're pregnant. That's a fact-ish. And you're most likely to get pregnant on a full moon. That is also seems to be a fact, but I'd like to see more research on that. Okay, number 6. If you're pregnant, you can't go into hot tubs. This is a fact. Ladies, listen up. You do not want to get overheated when you're pregnant. It's not good for you and it's not good for your baby. So you want to stay out of hot tubs. You want to stay out of hot yoga studios, even warm rooms. If it's summertime, you want to stay cool, dress with light layers, have a fan, stay hydrated. And you want to focus on moderate exercise instead of intense exercise. You just don't want to bring that body temperature up too high when you're pregnant. Also, being in a hot tub increases your risk of infection, which is just gross generally, and especially so when you're pregnant. But that doesn't mean you can't be in water at all. So warm showers can help you relax. I really like scalding hot showers, but even when you're pregnant, you want to turn that down to keep it warm. So again, you're not overheating. Massages are great to help you relax. And if you love the water, especially towards the end of your pregnancy when you're getting really uncomfortable, there's a lot of aches and pains, get yourself into a swimming pool. It'll really help alleviate some of that weight that you're carrying, give you some incredible break from all the weight that you're carrying and all the aches and pains that you're feeling on a day-to-day basis. Okay, last one, number 7. You can't get pregnant if you're breastfeeding. Ooh, okay. I have got a lot to say about this one. This one's false. This is a fiction. It is absolutely possible to ovulate when you're breastfeeding. Now, I know what you're thinking. How is that possible? When you're breastfeeding, you release a hormone that prevents you from getting pregnant or ovulating. And that's how women in a lot of cultures and many years ago use it as a form of birth control. How is this fiction? So here's the reality. Breastfeeding can delay when your period returns. You've probably heard of your friends talking about how long it took for their postpartum period to come back. It doesn't come back right away. But you can ovulate prior to your first period. You just won't know when that is. And also, for a while you're breastfeeding, your cycles may be irregular. Now, that's not because they're always going to be irregular since you had the baby. It's just while you're breastfeeding, your hormones are all over the place. They're different. So it's going to be hard to track when your fertile window is. So, yes, you can get pregnant when you're breastfeeding. Now, there's some thought that you can delay ovulation or even suppress it completely when you're breastfeeding, because since a hormone that you produce when you're lactating affects your estrogen and progesterone levels, which affects your ability to ovulate and conceive. So there's some thought that you can delay ovulation or suppress it completely for some time. But it takes a lot of effort. So here is what some experts believe. If you can manage 6 to 8 breastfeeding sessions per day, that's not pumping sessions, that doesn't include pumping, it's actual breastfeeding sessions per day, with no more than 3 hours in between feedings during the day and no more than 6 hours at night. Okay, that's one. Number 2, you can't sleep train your baby, basically, because you have to have a nursing session somewhere between 1 and 6 in the morning, which is when your prolactin levels are highest. That's the hormone we're talking about that's high when you're breastfeeding. That number 3, you don't supplement with a bottle. And number 4 is you don't introduce solid foods until at the very earliest 6 months or later. And the solids only act as a supplement and never replace breast milk, which is really what the case should be for babies at that age anyway. So if you can do all of those things, some experts believe that you can suppress ovulation, which then would be a form of birth control because you wouldn't be able to get pregnant. That said, I had a friend, Lucy, and surprisingly several others, who did all of that and were still surprised by a positive pregnancy test. Lucy found out that she was pregnant with twins when her oldest was only 5 months old. Obviously, at 5 months, she didn't know it was twins. She knew she was pregnant, then she found out a couple months later that it was twins. So if you really want to delay having another child, or if you don't want any more children at all, I really, really, really do not recommend using breastfeeding as your birth control method because it's not a guarantee. In fact, it's more likely that you get pregnant while you're breastfeeding than using some other birth control method. So if you don't want any more children at all, or if you don't want them right now, I highly recommend talking to your obstetrician for other contraceptive options that are a better fit for you. All right. This was fun. We talked about a lot of different things that came up. Number 1, eating spicy food helps you go into labor. Totally fiction. Lifting your legs up in the air for 20 minutes after intercourse will help you get pregnant. Also fiction. Fact is, you don't want to change cat litter when you're pregnant. A fact-ish is whether you should eat sushi or not when you're pregnant. Talk to your doctor about that. You're most likely to get pregnant on a full moon. Seems to be fact, but I'd love to see a little bit more information, some more research about that to be completely sold on it. If you're pregnant, you can't go into hot tubs. Absolutely a fact. And you can't get pregnant if you're breastfeeding. Totally fiction. This was awesome. You know, the reason, again, that we talked about this today is because it's important that you know the difference between fertility and pregnancy fact versus fiction so you can make healthy choices for you and your baby. You don't want to make decisions, even something as simple as what you eat or how you sleep or how often you rest or how much you put your feet up. You don't need that kind of stress and pressure and constantly second guessing yourself. You know, this is the time when you're starting to practice and kind of spread your wings as being mama bear. And so you want to come from a place of being informed and empowered so you can make confident decisions. And that starts with knowing the difference between fact and fiction in a world when we're just bombarded with so much contradictory information. Thank you so much for joining me here today. This was so fun. I hope you had fun today too. If you want to know more about how to improve your fertility or have a healthier pregnancy, I would love for you to schedule an appointment on my website at parijatdeshpande.com. We can chat about how I can help. And I'd love to stay in touch. I'm all over social media, but Twitter and Instagram in particular are great ways to reach me. So you can follow me at Parijat Desh, Parijatdesh, on both Twitter and Instagram. The best way to get excellent prenatal care is to make sure that you are an empowered, informed patient. And the way to begin to be that is to be able to differentiate between fact and fiction when it comes to your fertility and pregnancy. Take it one day, one step at a time. You can do this.